Individuals with Disabilities Education Act in 2004 defined speech and language disabilities as a communication disorder such as stuttering, impaired articulation, a language impairment, or a voice impairment that adversely affects a child's educational performance. Language and speech are the second most common disability in schools today. So what exactly does that mean? First, we have to define our terms. Language refers to a group of rules that cover what words mean, semantic, how to make new words, morphology, how to combine words, syntax, and what word combinations are best in what situations, pragmatics. Semantics deals with the meanings of words and how meanings connect. It deals with the content of language. A child with a semantic disorder will have poor vocabulary development, inappropriate use of word meaning, and/or inability to comprehend word meanings. For example, if a child struggles with indefinite references such as that and there, it is possible that they have a semantic disorder. Morphology deals with different pieces of words and the formation of new words. Children with a morphological disorder have problems with certain morphological rules. The S ending to a word that creates the plural is a morpheme. A child with a disability might not be able to distinguish different morphemes and they will display many grammatical errors. Syntax is how words combine into sentences. Children with syntactical deficits have difficulty acquiring the rules that govern word order and other aspects of grammar such as subject-verb agreement. They have trouble processing sentences, even simple ones, and typically produce shorter and less complicated sentences than their peers. Pragmatics is all about knowing what words and phrases to use in a social setting. Children with these issues have trouble distinguishing when to use them. For example, when someone says, "It's cold in here," they might be trying to prompt a response such as closing the window or turning up the heat. Issues students might have with pragmatics include how to make eye contact, standing too close, or how to introduce new topics. A speech impairment is present when the individual's speech deviates to such a degree that it interferes with communication, attracts unfavorable attention, and adversely affects the listeners, the speaker, or both. Types of speech disorders can deal with either phonology, articulation, rhythm, or voice. A phonologic disorder is an abnormal organization of the phonologic system or a significant deficit in speech production. One with this disorder might be hard to understand and/or be described as not producing sounds correctly. One example is apraxia of speech. Apraxia is a disorder that results from impairment of the capacity to select, program, or execute the positioning of the speech muscles to produce sounds. Articulation disorders are errors in the production of speech sounds. These include omission, substitutions, and distortions. Articulation errors may be related to anatomical or physiological limitations in the skeletal, muscular, or neuromuscular support for speech production. Fluency disorders are difficulties with the rhythm and timing of speech. It is basically an interruption of the flow of speaking, such as stuttering, whereas voice disorders are problems with the quality or use of one's voice that result from disorders of the larynx. They include absences of vocal quality, pitch, loudness, resonance, and/or duration. Slightly less than 20% of students receiving special education services are receiving services for speech and language impairments. Approximately 46% of all 3, 4, and 5-year-olds with a disability exhibit speech and language impairments. In the 2011 to 2012 school year, more than 1 million students identified as having a speech and language disorder. A cleft lip or cleft palate is a congenital abnormality that occurs in about 1 in every 750 births, making it one of the most common birth defects in the United States. Hypernasal speech is fairly common in youngsters with a cleft palate. Fortunately, surgery and/or a prosthetic can correct or minimize the impact. There is not too much known about the cause of these various speech and language disorders. However, there is a potential to try and prevent them. Infants arrive in this world prepared to understand and use language. Parents and caretakers must be sure to nurture them and expose them to many linguistic experiences. As a teacher, you might want to assess your child to determine if further action should be taken to see whether he or she has a speech or language problem. One of the most important tools in the assessment process for speech and language impairments is the case history. It is extremely important to include the family and communicate with them effectively. The majority of students with speech and language disabilities are in general education classrooms. Services that can be provided include speech-language pathologists, technology such as augmentative and alternative communication (AAC), and speech-generating devices. Research has shown that AAC has significant benefits for individuals with speech and language impairments. Any type of teacher will almost definitely deal with a student with a language or speech disability in their classroom. It is important to realize that they may not process language or directions that easily. Also, they may struggle to express themselves in and out of the classroom. This can be very frustrating to them and cause great stress. Teachers must be understanding and work with the student. Parental communication is key for any student with a disability. Teachers should let the parent give them advice about their child and have open discussions. They need to set common goals that are agreed upon and can both work towards at school and at home. These discussions can also include the student so he or she is aware of the goals that must be reached. At some point in any teacher's career, they will have a student with limited proficiency in English. Unfortunately, the lack of reliable and valid assessments makes it extremely difficult to accurately identify speech and language impairments in children from culturally and linguistically diverse populations. Due to this, many English language learners are misdiagnosed. There are many teaching options to use for students with speech and language impairments. One is to make sure there are limited auditory and visual distractions in the classroom. Speaking is also important. When speaking to a child, make sure you have their attention and speak slowly and clearly. Give simple directions and check comprehension by asking. Using visual aids that are familiar can help a child understand. Varying loudness to increase attention as well as making transitions clear will most likely help all students in the class. Pre-teach vocabulary and point out key words and recognize when a break might be needed. Make sure never to show frustration if the child misunderstands. My discussion question is, getting frustrated at students is sometimes hard. What are some ways you might avoid getting frustrated when students do not listen to directions?